Hello and welcome to GOT Transition's 8th quarterly webinar, 6 Core Elements of Healthcare Transition, Improving the Transition Experience for Youth and Families. I am Ann Walls, Project Manager for the National Healthcare Transition Center, otherwise known as GOT Transition. In a minute, I will review today's agenda, then introduce our 3 speakers for today's broadcast. First, I want to share some information about GOT Transition and this webinar. First, we acknowledge the federal funding that supports GOT Transition through a cooperative agreement with the United States Maternal and Child Health Bureau. We do record all broadcasts and you may access them from our www.gottransition website. Please pass this information on to others as an opportunity. We appreciate you responding to an evaluation that you will receive at the conclusion of today's broadcast. So first, a couple of procedural notes about today's webinar. A particular note, there will be a 10-minute question and discussion period after our speaker presentations. If you wish to submit a question, please do so in the question box on your screen in the operating box. You may do so at any time during the presentation, but we will hold all questions until the appointed time of our agenda. At that time, I will read as many of the questions as possible and solicit responses from our speakers. Those questions that we may not get to will be compiled in a question and answer document and posted on our website within a week. And by the way, if you're not able to see these slides for whatever reason, you may download them from the homepage of www.transition. So today's webinar focuses on the 6 core elements of healthcare transition, a package of tools and processes that GOT Transition developed to support improved practice-level healthcare transition services to youth and young adults transitioning from pediatric to adult care. Some of our past webinars have introduced and reviewed these resources and how they have been successfully implemented in practice settings. We hope this webinar will shed further light on how specifically they support patients and their families as they plan, prepare for, and experience the transition process. This is our agenda today. Dr. Laura Pickler will review the 6 core elements from an experienced provider perspective. Following her presentation, we will hear from Eileen Forlenza and Mallory Cyr with a consumer perspective. We will then take your questions and comments for discussion. Before I more completely introduce our speakers, I want to quickly familiarize those in our audience who may be new to our National Center. In brief, our goal is to support an improved healthcare transition from a pediatric to an adult model of care by advancing healthcare transition implementation in pediatric, specialty, and adult practices. As mentioned earlier, we are addressing the need for improved healthcare transition on behalf of youth and young adults with or without special health care needs. In aiming to achieve our goals, for the past 3 years we have supported learning collaboratives made up of pediatric and adult provider sites in Washington, D.C., Denver, Boston, New Hampshire, and Minnesota, and Pennsylvania. That's all right. Using a team approach and a quality improvement process, all 6 of these learning collaboratives implemented the 6 core elements over a period of 12 months or more. They each tracked their progress, piloting a measurement tool GOT Transition developed called the Healthcare Transition Index. You can find our tools, including examples of some of those that the learning collaborative teams modified for their own setting and needs. And you can also find the index on our website. So now I'll introduce our speakers for today. Dr. Laura Pickler is a family physician with an active primary care practice serving children, youth, and young adults with special health care needs. She is Assistant Professor of Family Medicine and Pediatrics at the University of Colorado, Denver. In addition to taking a lead role implementing medical homes for children and adults underserved in the community, she has been active with GOT Transition, serving on its cabinet and as faculty for the Denver Learning Collaborative. Dr. Pickler participated in the writing group of the Clinical Report on Healthcare Transition, published by Pediatrics in July 2011. We are really pleased to have Dr. Pickler with us today to speak on the 6 core elements from a practice level perspective. Eileen Forlenza is the Program Director of the Colorado State Title V Children and Youth with Special Healthcare Needs Medical Home Initiative and has extensive experience in family, patient-centered care curriculum development, analysis, and consultation at the local, state, and national level. Ms. Forlenza has been associated with GOT Transition as a cabinet member, learning collaborative faculty, and as a family leader and advocate. She and Mallory co-host the monthly GOT Transition radio show. Mallory Cyr is the National Youth Program Manager with GOT Transition. Many of you know she co-hosts, as I said, the GOT Transition radio and also oversees our social media outlets. Being very much a self-advocate, she works with youth and young adults, coaching achievement and independence. Walking that talk, Mallory is currently a graduate student at Boston University, where she is pursuing a degree in public health with a concentration in maternal and child health. We are really pleased to have Mal and Eileen once again teaming up today, as they do for GOT Transition Radio, to share their perspectives on healthcare transition improvement. So now I'm going to turn the microphone over to Dr. Pickler.
Thanks, Anne. Next slide, please. So what my part of our webinar today is to talk about the healthcare transition 6 core elements, and in order to do that, we wanted to tell you about the clinical report. Some of you may already be familiar with the clinical report, which was published in 2011 in Pediatrics and is available online if you haven't seen it yet. It was developed by an expert authoring group over the course of several really long weekends as we met over a couple of years in order to hash out our differences and also talk about all the different aspects of transition. It was also approved by the American Academy of Pediatrics, the American Academy of Family Physicians, and the American Society for College of Physicians for Internal Medicine. And so then it was sent out and reviewed by a large and diverse group and was funded with support from the United States Maternal and Child Health Bureau. Next slide, please. So there are some key things about the clinical report. When we wrote it, we were trying to target all youth, and so not just youth with special health care needs. And so you'll see in just a minute the algorithm that really goes through a framework on how to think about what the roles are for transition for all youth. And there are branching points that include youth with special health care needs because we do want to acknowledge that those young adults may have some extra things to think about during this time. There's also a framework for future condition or specialty-specific applications. Again, transition is not just the role in primary care, it's also the role of a specialist. And in my role as a clinical geneticist, we often talk about transition for young adults with specific genetic conditions and what that might mean for their families. There is explicit guidance about practice structure and process beginning at age 12. And some people feel like age 12 is really too early. Other people feel like it's too late. And so one of the things that we often want to stress whenever we talk about transition is that we're giving some age ranges that are more than a suggestion, but also do lend themselves to some flexibility depending on the needs of the patient and the family. The algorithm extends through the transfer of care to an adult medical home and adult specialist, but doesn't explicitly dictate what that is supposed to look like. Again, providing structure without being so prescriptive that there's no room for flexibility. Next slide, please. So this is a picture of the algorithm. If you start at the top and go down, that's how we intended for you to look at it. It takes into consideration that all youth and young adults should be served within a medical home model of care. And so that's the premise that we started with. You'll see that the medical home interaction starts at age 12, and not just where it starts there, but that's where transition is first discussed, and then extends through when the patient is 18 or older. All steps in transition can be addressed at any time. There are action steps at each age range. And then if the patient has special health care needs, you can see in row 4, that's where the branching point is. And mainly what we wanted to do there is just call out that there may be some special things, additional things, or maybe some things that don't need to be done for a patient with special healthcare needs. And that's something that the patients and families are encouraged to speak with their provider about in order to tailor care for their specific condition. And then you'll see row 6, we call it interaction complete. That's when transition is complete and transfer of care might potentially be complete at that time. I'm going to talk a little bit more in just a few minutes about the differences between transition and an actual transfer of care. Next slide, please. So what are the 6 core elements of healthcare transition, and why did we decide to have an additional layer of process beyond that of the algorithm that I just showed you? Well, because the algorithm, like I said, provides structure, but it's not a prescription. And so the 6 core elements are aligned with the clinical report. They are intended to improve the healthcare transition support and process for patients and families, and also provide providers with tools and processes that they can customize to their practice. These have been tested in pediatric, adult, and specialty settings and are all available online at gottransition.org. Next slide, please. So this is a picture of what the 6 core elements look like online. And I'm not going to go into them in detail on this particular slide, except for this, that you should see that there is a role for a pediatric healthcare setting and a role for the adult healthcare setting. And it is important for each person to know what their role is, both from a provider as well as from a patient and family perspective. And hopefully by the end of this webinar, you'll have more of a sense of what that means. Next slide, please. So the 6 core elements of healthcare transition are labeled here 1 through 6. So the first one is a written policy. We suggest that this be put together by the practice and posted prominently in the office so that patients will understand exactly what to expect around the transition process. For patients and families, in our experience implementing the 6 core elements, it really takes a lot of the anxiety out of it if they have some idea of what to expect. And number 2 is the registry. We want the patients to be able to be easily tracked within the practice. And I'm going to talk about that more in just a minute on how a practice might implement that and what it looks like. Number 3 is preparation. So this is the meat of it. How do you get ready for transition, and what does that look like? And then transition planning is really a care plan that is put together in collaboration with the patient and the family, just so that nothing gets missed. So that's the organization piece. And then the actual transfer of care is when everybody's ready, you can have a transfer to an adult provider. It's usually after 18 for most use. And then completion at the end is really how we define success. And it helps us know, too, what to do with the information that we glean in terms of how the process has benefited patients, families, and also the practices, both sending and receiving. Next slide, please. So a healthcare transition policy, where I'm going to show you an example in just a minute, but an explicit policy should describe the practice's approach. And for some of our practices that have gotten started making a policy, it really involved having all the members of the practice sit down and agree on what the policy was, because oftentimes people in the practice have different ideas, whether they're stated or not, on what they think transition should look like and what the practice's role is. And until you sit down with every member of the practice and get figured out and sometimes resolve some conflicts around what this looks like, it really can be confusing for patients and families and for other people working in the practice. So an example of this is the other day, I saw a patient, and I have in mind what I think their transition should look like, and yet they saw a provider just the day before in a different specialty in our hospital who gave them completely different information. And so the patient, I think, has every right to be really confused. And in this case, I think there were some misunderstandings that were created that could have been totally avoided if we had had a more specific policy. It also fosters teamwork, and I think this is especially important between specialties. So I may see a patient for primary care purposes in my practice, but in my institution they may see 6 or 7 other specialists that are also helping to take care of some aspect of that patient's care. If we're all working together, that honestly, I think it feels better, and it also goes much better too with regard to transition. So if you know who the other people who make up the patient's medical home are, and you can all work together, that's really the ideal situation that we're going for. Next slide, please.
Sure. Dr. Pickler, we've gotten some requests to ask if you might speak up a little bit. Some people are missing, apparently.
Oh, sure.
Thank you.
Okay. So this slide is an example of a transition policy that's actually in use in one of our pilot practices. So if you'll look at the top, it says the practice's name is Partners in Pediatrics. So this policy basically says we at Partners in Pediatrics believe that transition is important, and then you can read down from there what they basically say. They want to honor preferences. They have some age ranges in there of what their expectations are for young adults and families. Then if you go down, they felt it was really important to have a message specifically to the young adults. And so they wanted to make sure that this was worded in such a way that young adults won't be confused, and that transition in its core is to help a young person be an independent advocate for themselves. And so if you only write the transition policy to a parent, you're really leaving the young person out from the beginning, and they were very intentional about not doing that. Next slide, please.
I'm sorry, just having a little trouble here with, there we go. Sorry about that.
That's okay. So this next piece is about a registry, and so many adult practices are already using registries that are either built in through their electronic medical record or through a secure spreadsheet. And these things are part of the patient-centered medical home certification process and are really required in order to meet criteria to maintain their medical home certification and also to meet meaningful use requirements. So if you are on the webinar today and you're part of a practice that's doing these things, you'll know what I mean. If you're a patient or a family member and you are going to be talking to your practice about this, some of the buzzwords you might want to use are around this meaningful use. What that basically means is, do you have an electronic medical record that you can actually use to its fullest potential? The registry supports planned and coordinated care, and then when I use my registry, it really helps me see who the patients are that are actively in the transition process. If there are some patients that are about the same age or going through the same things or have the same questions or even the same medical condition, it allows me to be able to see who they are so that I can set up a possible group visit, because I have found that young adults like group visits a whole lot better than coming and just seeing me by myself. And it's probably because I'm a little bit boring if you're a young adult, and if you can be in a group of your peers all talking about the same things, it just makes it much more fun. Next slide, please. So this is an example of what a registry might look like. And you can see it's basically a spreadsheet. There's nothing that's rocket science about it at all, but it does have protected patient information on it. And so practices need to make sure that this meets requirements for patient confidentiality as well as HIPAA requirements. And so you'll see there's the birthday, the age of the patient's name, you've got to be able to find them. Their primary diagnosis is there, and sometimes the thing that is the most, that is their primary diagnosis may not be the thing that is most important to consider from a medical perspective. So the doctor may put, something different in that slot than what you might think. And then you can basically say, okay, when were they last seen? Do they have another appointment scheduled? Do they have a way to maintain their insurance? Which definitely affects their access to care. And then is it a patient that seems to be doing quite well from a medical standpoint? Is their health condition stable, or is this something that their health condition is not stable and require, the medical piece to begin with requires a little more interaction. Next slide, please. So transition preparation is really important. Like I said, this is where the rubber meets the road. How do you help a young person move from being a dependent child to an independent adult who's able to manage their own care? And you'll see in the picture in this box, the picture on the slide sort of made me laugh because the dad is filling out the form and the young adult is watching. And so ideally we would like to move from that sort of a picture to having the young adult or teenager filling out the form and the dad watching. And because practice is how you figure out how to make these things work. So the healthcare team should be assisting youth and families to learn how to practice adult healthcare skills. And some of these that I think are the most important are, how do you get your medications refilled? How do you make an appointment? How do you know when you need to go see your primary care doctor, a specialist doctor, or maybe the emergency department? All of these things require practice. And sometimes articulating exactly how to do some of these activities, you'd be surprised, but it's actually not common sense, and there's not a lightning bolt that comes out of the sky that makes you all of a sudden have this sort of knowledge. So you can assess readiness using a tool, which we're going to show you in just a minute, and then just keep in mind every office visit is an opportunity to address some aspect of transition. You don't have to have a special doctor's appointment just to talk about transition, although sometimes we do that. Next slide, please. So this is an example of a readiness assessment, and it's just a piece of it actually. So if you go to Got Transition online, you can see the entire readiness assessment. The most important part of this is really to think about, is this something that the young adult can do? Is it something they want to do or need to learn? And if they're unable to do it, who's going to help? And thinking through that is really important. Next slide, please. So in terms of planning, this is really a care plan. If there's any nurses on the call, they're probably very good at this. But basically using an integrated care plan to address what the next steps are. And this is the organization part. Who's responsible for what, and what timeline are we trying to accomplish our goals? It should be shared and accessible. It should follow the patient and include the community resources and service providers. So an example in my practice would be that I might have a care plan. It would include the things that take place within the hospital walls, but if I have durable medical equipment companies or formula that's provided by someone else, that's all also always in the care plan so that we know how to get the patient what they need. Next slide, please. So this is an example of a blank care plan. You could fill this in however you want. Some of the ones that I've made are 6 times as long as you would think, but other times you really only need the 1 page. So this can be customized based on the individual goals of the patient and the family. Next slide, please. So I wanted to make a point about the difference between transition and transfer of care. So a transfer of care is really that handoff that requires a handshake. It's that last visit with one provider as you're getting ready to meet your adult provider. And it's helped by an exchange of information, agreement about timing, agreement about roles, and communication. Next slide, please. So the transfer package is really tailored for each patient. There should be always a few of these elements, though, that are I'm going to list today. So a cover letter of introduction that says what the date is of transfer and also the date of the adult appointment. This is just, I think, common courtesy so that everyone knows what to expect. There should be a recent readiness assessment that details what the young adult has accomplished. And then it can also say things like what things they're still working on or might need some help with. There should be a summary letter of their medical care, an emergency letter, which helps in case there's a gap in care, condition action plan if needed, and then the latest transition steps. And I often find when I'm sending a patient from pediatric practice to the adult practice that all my ends don't have to be totally tied up on the pediatric side. it's nice if the adult team has something that they can work on right away when the patient establishes care. And I think it helps them feel like they can hit the ground running and really be useful to the patient and the family. If the patient has a guardian, power of attorney, custodianship, something like that, those documents should be included. And then there should also be any plan for what happens with specialists, not just primary care. And then there needs to be a plan for what happens with it in the interim time between the last visit with the pediatric provider and the first visit with an adult provider. What's the patient going to do if there's an emergency that arises during that time? How is communication going to happen? Next slide, please. So really, transition completion, which this is the sixth of the 6 core elements, it involves having good people, the family, friends, confidants for the patient, good care with partners, and continuity in both the medical system as well as in the community, and then good health. And we have here confident independence. And all of those things together come together and basically have a healthcare transition plan that's successful. We like to say that our young adults, our goal for them is that they have choices for how they spend their time. And if they're not healthy and they have to spend all of their time at the hospital, that's actually not a choice. And so that's not what we want for our young adults. Next slide, please. So next you're going to hear from the patient and the family's perspective. And they're going to talk about what each of these 6 core elements mean to them specifically, and how they work with the providers that are part of the professional medical team. Eileen and Mal?
Great. Hi, everyone. This is Eileen Forlenza, and Mallory, I believe you're on with us as well.
Yes. Hi.
Great. Okay. So I'll get started, and I want to just at least kind of make this real for those of you who are tuning in. This is real life for me as a parent. My daughter in the middle there has special health care needs, but I also have 3 other kids who are right in the middle of all of this transition. So as a parent, I am assessing this whole process as we're going through it together as a family. And then my role with Got Transition, the National Center, is to make sure that I have the appropriate kind of policy analysis hat on when we're looking at that. So I just wanted to share that with you guys. That been doing this for a while, and it's very personal for me and very exciting to be a part of the project, so thank you. Also wanted to show with you kind of what our family situation was. You can move to the next slide, please. Was when we were approaching transition for Holly when she was 19, at that time, indeed, our pediatrician just pretty much told us, she's finished at 19, and there was no transition, there was no transfer of care. It was just our very final child check was complete, and we received a file and a letter and said, thanks, it was nice to know you. So so when I was looking for a new provider, and we just happened to switch insurance at the time, and I made the appointment well in advance, let them know this would be a transition appointment. I did all of my homework. I had a workbook that actually Dr. Laura had produced prior to this, to the work that Got Transition has done. It was called Time to Transition, and it was a kind of an all about me summary notebook, and I presented it to the physician on that very first day of our transition appointment, and we were completely dismissed. She said she was not interested in looking at the workbook. She was not interested in looking at anything paper because they were all electronic at that time, and she really didn't have time to read anything, and asked me again, well, what are you here for? So this still remains unresolved with that large practice that we're in. I just recently, really recently, a couple of weeks ago, received a call from the maternal child health program of that hospital system saying that they've been made aware of this situation, and we're going to start working on some support. So, but it's been a couple of years, believe it or not, and we have kind of been just taking care of the acute care situations that have come up. But as you'll see on the next slide, Holly, because of her special health care needs, has an actual, has a pretty big team of people that we consider part of our medical home team. And of course, with Holly and I and our family at the center, we access in that second ring quite a few of healthcare providers that are important for her everyday health. And then the next ring are just really kind of where life happens, and when we go to camp, and how we're accessing community services, and all of that has to be rotating in order for her health universe to work very well. So I just wanted to show that visual to you so that you see that my family, as well as many others, are juggling many issues when it comes to the healthcare team, but we remain committed to the medical home model, and we believe in a team-based approach to healthcare, and that's why transition is so important for us. You'll also see on the next slide that when I say it's important to us, it's, I kind of borrowed this cartoon from Dr. Laura, because what this says to me is that as a family, typically when a kid is, been living at home in their bedroom, and at some point parents want to say, well, hey, aren't we getting ready for you to check out here? Aren't you 21 years old? And again, having 4 children, including Holly, this age is really important, and it's a moving target in terms of when do you check out and how do you support their healthcare transition. And so as we move to the next slide, I just want to kind of point out that what's most important is for us to be able to kind of compile a lot of this together. And Mal, I don't know if you want to speak to this next slide about somebody needs to write this book, and then I'd like to talk about what parents are actually asking and what they're saying. But doing this together, I know your mother well, and we've talked a lot, and you always can see that. Well, while Ann is driving this, I will just share with you guys that, this conversation about transition is actually becoming a little bit more in the everyday social media. And I've heard a lot of other young people on college campuses talking about it. I've been in several conferences and meetings across the country where people are unsolicited really kind of coming up and asking and talking about, what about kids going away?
Mal?
Yeah, so I think for the sake of time, we're going to move on. We have another clip if we have time at the end. But I want to jump in and talk a little bit about my experience with transition and how real this has become for me. And the interesting thing is, I never really understood that transition was even an issue until I started this project with Got Transition. Then I started reflecting on my own experience, realizing how fortunate I was and how seamless my transition was. Even though there were some bumps in the road, it made me sort of look at my own experience differently. And it also made me realize how fortunate I was with the knowledge and self-awareness that I have about my own health, and that I've always had growing up, thanks to my parents and the amazing support system and resources that I have accessed. And so with my role in Got Transition, I have reflected on that experience. And the interesting thing is, even though I did transition my own health care when I turned 18, and then I switched my specialty care once I graduated college, just recently I moved to a new city where, as Ann said, I'm pursuing my master's degree. And so that has been a whole new set of challenges, and as you can see from that picture, recently I was hospitalized, and so I have been dealing with a whole new set of providers. And coming up next week, I have my first appointment with new primary care in Boston almost a year after moving here. So I'll talk a little bit more about that as we progress, but I just wanted to share a little bit about how this topic, as Eileen mentioned, has really come to life for me, and some of my various experiences where, even though I do this work and I'm going to school for health, sometimes we have to realize lessons about focusing on our own health and making our own transitions a priority. So with that, thanks, Eileen, and I would love to hear some more about what families are saying.
Well, thanks. Yeah, you know, working with many clinics and systems across the country, I've kind of pulled together just 5 or 6 comments that I thought were pretty profound, where parents were in working with a lot of the practices, we were asking them to kind of survey and talk to parents about how are they feeling as the practice was creating a policy. And these are some of the comments which I think are really interesting. You know, from as feeling neglected as is my doctor kicking me out, like what is all this about, to kind of a sense of on bullet point number 3 where it says, look, I'm the parent here, I pay the bills, why am I being asked to leave the room? Back to that photo that Laura showed earlier, what we want is to show that kind of independence, and what we get with that is still some parents who are just not ready. They don't have the tools or the skills or the awareness that this gradual training ground of moving into the adult health system is really, really, really important. And then to the final comment that this slide indicates is, you know, just kind of a sense of fear and concern, where this parent says, my child has very complex healthcare needs. You have known them since they were a little baby. How will anyone else know them as well as you do? And that's the part where that's the systems part that we are all dedicated to how do we create a system that supports families and young people through this process. If we were, when you guys can, those of you participating today, when you download this group of slides, you'll see in the link that we were going to show you a clip from Friends where it's just not appropriate for a 20-something, 30-something-year-old to still see a pediatric provider. And that's the systemic piece that has just not been talked about, and that's what this bullet point speaks to. And so in the next slide, what we're really looking at again is that it goes back to the 6 core elements of what's the policy. For a family to be able to see a policy in their provider's handbook or on the wall, in the waiting room, in the bathroom, out in the waiting room, on a laminated piece of paper, it gives families an opportunity to just begin to have the conversation. And having a stated policy really, really, really helps. And what typically happens is what I have indicated in our journey, which was we were just told this is your last visit, or when, Mallory, I don't know if you want to pick it up from here about what happened when you were 18 and what the quote-unquote policy was at that time.
Yeah, and for me, it was very much a similar situation. I had been going to the same provider since we moved to Maine when I was about 5, and my parents had a very close relationship with them. I was comfortable with them, and then when I was 18, we were simply told I wasn't able to go there anymore, and they could not refer me to any other providers. So my advice to families who are experiencing this is, if your practice has a policy, first of all, ask if there is one. And I have seen many mixed reactions from this part of the 6 core elements, where a lot of young adults and families feel as though once they're shown the policy, that means they're getting kicked out of the practice. So my advice would be to take that panic and turn it into planning and preparation, and use this opportunity to get your questions asked and say, how can I find a new provider if you can't refer me to anybody? Talk to other families you know that may have young adults with special health care needs, who comes recommended. You know, really get your questions asked and take advantage of this policy. And if your practice doesn't have one, ask them why, and show them that this is a possibility and the resources for from God Transition. Next slide. The other thing that I think is really great, and that has been an amazing tool for me in terms of the 6 core elements, and where I feel is a great opportunity for youth and families to really get involved in the process, is the Readiness Assessment. And this is a tool that I actually helped to create in the previous circuit of funding when the grant was called Healthy and Ready to Work. And this tool is a checklist that there is a youth version and a family version. And what I encourage people to do is to either in the practice setting or as a mailing home to the patient, have the family and the young adult sit down together and go through this and look at what steps can be taken that either the young adult can do themselves or where those supports can be identified if that independence may not be possible for that person. And in my experience, this was really interesting because coming onto this project, I thought, you know, I had it made. I knew everything about my health. I was really kind of cocky in this situation. And as I was going down this checklist, there were such small things that I didn't do for myself, but I discovered that I could. So this was a really big turning point for me where I discovered what I did know and what I had left to learn and how much there was in terms of transition. So I really encourage providers and families to really take the time to utilize this tool, as I think it can be a crucial part of the transition process. Next slide.
Yeah, I think, Mal, what you've just said really goes into the top 3 things that I have often considered to be really important talking points with parents, and that is, as you just said, empower your child. If I'm talking to other parents, these are the top 3 things that I would discuss with them. And so this is helpful for those of you on the call today who are providers as well as parents to just empower your child to be a wise healthcare consumer. And as Mallory said, that goes into the readiness, the checklist. It's all on the 6 core elements related to preparation and planning. And to understand that healthcare transition is a lengthy process, starting early with small steps. As Dr. Laura said earlier, some people say age 12 is too early. Some people say it's too late. I do think it's just a very long process. I started with my son Michael when he was in 5th grade, as he went into his 6th grade well-child check with a doctor to prepare him to play football and baseball for his physical. So since 6th grade, Michael's been coming up with 3 questions that he's going to ask his provider when we go into his well check or his physical is what the case is for him. So, and also back to the 6 core elements, bullet point number 3, discuss with your child how decisions will be made. That speaks to the transfer of care and the actual transition. When we transfer to an adult care model, how are decisions going to be made? And to be able to speak with the young person about how it's different in the adult care model. The parent doesn't have to, should be, may not want to be in the room with the young adult. In my family situation with Holly, she's nonverbal. That won't be the case with her. But with my other kids, they don't want me in the room when it gets to be some of those personal discussions about sexual activity, tobacco use, things like that. So we have to honor that in all fronts. As Dr. Laura said, transition is for all youth and includes use with special health care needs, but we need to be sensitive to that. So as we move to the next slide, what's so important with the care planning is keeping it youth-centered. And Mal, I think you're better suited to address this slide.
Yeah, I just want to go through this real quickly, and then we're going to sort of wrap up as we're short on time, and we want to have time for dialogue. But I think that care planning is another piece where it's really important to remember that it is a process, and it's not just about the send-off or a checklist, and that we need to put transition in perspective for what is important for young adults. Families and providers need to take the time to ask the questions, what is important to you? What do you need to be healthy to do, and how do you want to spend your time? I think sometimes these questions don't get asked, and young adults with special health care needs and disabilities get in these places of sort of plateau where they don't feel fulfilled and aren't moving towards anything. So it's really important that these conversations happen and that health is maintained so that these goals can be accomplished. Next slide. And again, I just want to say a quick reminder of how, even when the torch is passed, we never know when transition is going to come up again. It's a very cyclical process, thinking about moving away, going to college, starting a job. All of these things are really important. So as we move through the algorithm, there's always going to be a time where we can come back to the beginning or to a certain point. So we just need to remember that in the process. And again, with family, planning, preparation, and peer support, setting those goals, it all leads to a successful transition and possibilities. And so with that, I'll let Eileen wrap it up, and we will cut to Q&A. As I've seen, we've already had some questions coming in, which is great.
Great. Yeah, I would just remind the listeners that when it comes to all the 6 core elements, starting especially with policy, that the value of family engagement is really important, and to know that there are families who, I mean, clearly this is a patient-centered discussion we're having, but when it comes to policy, remember to include families as you're writing that policy and the youth themselves so that they're involved in what that policy looks like. And the next slide indicates, again, that's why this is family-centered care versus patient-centered care, because this is a whole person model, and a young person exists within the context of a family, however they define family. And I think that that's really important to remember. And as this next slide indicates, again, we want to make sure that as you are creating policy, as you're considering your process, your referrals, your EHRs, to know that family-centered care is not just at the exam table, it's also at the policy table as well. Because we really want to shift from just servicing families to partnering with families. And we want to make sure that we see families and youth as partners in this and not just the consumer of services. We know that it's well documented. I just included a quick slide on the AAP's recent documentation of how family and patient-centered care impacts at the practice level, and the research is finally catching up to what we've known anecdotally. So that concludes those slides, and I think we've got some time now for Q&A.
Great. Thanks, Laura. Thank you, Eileen and Mal. And I want to apologize to everyone for the technical difficulty we had. We thought we had that video lined up, but apparently it didn't come through. So, again, I apologize for that technical difficulty. And thank you, Mal and Eileen, for modifying your presentation so we could take a couple of questions. I have one here. Maybe Dr. Pickler would like to address this. This person says, interested to learn about the MedPeds approach. I observed a MedPeds doc with a special needs adult a few years ago, which was very helpful. Could a transition to internal medicine MedPeds MD be a solution for some of these patients?
So this is Laura, and absolutely, that's true. MedPeds is a specialty where they actually do 2 residencies. One in pediatrics and one in internal medicine. Historically, most physicians that are MedPeds trained have tended to shift towards one or the other. It's really hard to do both. So if you have a provider that you like that is MedPeds trained, that person might be ideal for you. When I'm counseling families on how to pick an adult provider, one of the main things that I think is important is that you don't necessarily have to have a provider that is an expert in whatever your particular condition is that you're interested in or that you have. You need to have someone who you can work with, who will listen to you, and who you feel like you can have good communication with. And if that person is MedPeds or an internist or a family physician or a PA or a nurse practitioner, you know, their training has something to do with whether or not they would be a good fit. But ultimately, you need to meet the person and make sure that the office and the practice is a place where you feel comfortable.
Thanks, Dr. Pickler. Here's another question, which I'm actually going to ask both Dr. Pickler and Eileen to weigh in on this one. What specific transition plans are being considered for young adults with global developmental delays and CP, through, I'm assuming cerebral palsy, from a pediatric hospital setting to an adult setting? For example, young people who can't advocate for themselves. So I wonder if you could each weigh in on that.
Go ahead, Laura. You can start, and I'll come up after you.
Okay. So a transition plan, regardless of the underlying diagnosis, should include the same basic elements, which involve categorizing what the active diagnoses are. I often think that the historical diagnoses are also very important because it gives the adult providers a sense of where you've been as a patient and a family, because there's sometimes a lot of work that took to get from birth to however old you are. So there needs to be a distinct medical piece that goes through what are the active diagnoses and what's being done about them and what's the plan for that. And that's something that most physicians should be pretty familiar with, and I would think comfortable doing. The nurses in my practice are probably better at writing the plans than I am. We have often a conversation about it, but when it comes down to who's going to do what, where will that take place, and when will it happen, those are really the key points. And if you happen to have a diagnosis like cerebral palsy, I'll use that as an example. You might have a rehab department that you're going through in your pediatric practice. Our hospital has a CP clinic, actually, where you can see an orthopedist, a physical medicine and rehab doctor, the folks who can service your wheelchair, your equipment, the assistive technology people. I mean, you know, there's this whole team. So since that doesn't exist in the same, it doesn't look the same in the adult hospital, but all the services, though, are still available. So what the care plan needs to detail for you would be how do you go about getting those same services coordinated, even if it doesn't look the same as it did in pediatrics, since they're still available and you can still access them. What does that look like for your family? So that's really the question that I think you know, most people don't know how to answer.
Great.
Eileen, do you want to
Laura,
talk about? Yeah.
Yeah, I really appreciate this question because, you know, as a parent, even thinking about this, I know it really kicks up my grief cycle. You know, I've talked about this before that, you know, all these kind of milestones cause me as a parent to really look at where am I in this life course with Holly. What I know beyond anything is that I need to respect the fact that even though Holly's cognitive abilities are you know, keeping her in a lower end of functioning, she's still an adult. And and I have to respect that part of her as a young woman. And I think one of the biggest challenges in this transition is navigating the adult Medicaid program, for example, and some of the functional societal kind of, I don't know, like it's just not appropriate for a 23-year-old to be sitting in a waiting room with a bunch of 2-year-olds and with Legos. And I know that if Holly could speak, she would express a desire to be with people her own age, regardless of the fact that her functionality is a little bit low. So I do think that we as a family have talked about this a lot, and we started talking about this when she was in school. I mean, it's the analogy is even though in kindergarten she wasn't reading or writing or doing all the things that kindergartners need to do to pass to go to first grade, she still needed to go to first grade. And she had to go to middle school and she had to go to high school. And all of those, again, functionally, maybe she wasn't doing, but it's from a community perspective and from the just the societal perception, it makes sense as a family for us to move Holly up in that way. So thank you for asking.
Thank you both. We had a question here that asks what is an EHR, and I'm going to answer that, but then I'm going to turn it back over to Dr. Pickler and maybe even Eileen and Mal to weigh in on this. An EHR is an electronic health record, otherwise known as an electronic medical record. And I'm going to take it one step further and ask you, Dr. Pickler, to sort of quickly review the ways that an electronic health record can be part of a transition system at a practice level. And then I'm going to ask Eileen and Mal quickly because we're coming near to the end of our time. How an electronic health record might impact you as consumers with the transition process. So, Dr. Pickler first.
Okay. So no one told me when I was in medical school that a big part of my job was going to be how to work a computer. And so that's something that isn't in my natural skill set, and I've actually had to work a little hard at it to make sure that I'm proficient. So an electronic medical record basically is a big computer program that organizes a patient's chart, similar to what a paper chart would look like, so that you know exactly what's going on at a glance. So what's the problem list? What are the medications the patient has been on? Where is that patient in terms of immunization? What's missing? What are some medicines that didn't work? What are the things, I could go on and on. It's the parts where the doctors chart about what happened, what needs to happen, and what their plans are for the follow-up visit. All of that is in a computer, and as a nation, we're moving towards making a computer-based medical record to be the standard of care. And ideally, even, you would be able to access your own medical record from your house. So we have a system at our hospital called MyChart, and a patient is given a secure login. And so I ordered some labs yesterday, and the family will be able to check them possibly even before I see them in the next day or so after the patient has their blood drawn. And ideally, this could be accessed anywhere in the country. I was on call last weekend, and I got a call from Tennessee about a patient that I hadn't actually ever met, but they were in the emergency room in Tennessee, and the doctor said, we'd really like some information. And I said, well, does the patient have their MyChart account, set up? Because if they do, all they need is an internet connection, and then their entire medical record is at your fingertips. So it's really about good patient care, communication of essential functions, and the ability of patients to be more involved in their own health care, which some people have differing opinions on. But in the end, I think it's really a good thing.
Thanks so much. And Eileen and Mal, I'm going to ask you to limit your impressions of the electronic medical record and how it impacts you as consumers in 2 or 3 words or less. I'm going to challenge you because we're running out of time here.
Okay, go ahead, Mal.
I will just say, great idea, still being fine-tuned.
Great.
Mm-hmm. And I think caregiving should be included in the health record, not just the actual medical record. But when you, a child with special health care needs, also there needs to be documentation on the actual caregiving.
Great, thank you. I'm sorry that we couldn't take more questions. As I said, we post them within a week on our website, where we also will have archive of this broadcast. Want to just quickly give you an infomercial about the next God Transition Radio episode coming up, May 29th. Here's the topic: medical limitations in travel. Blaze a trail or head for the hills. And Mal's going to have 3 young women speaking about this really important topic. And as I said, you can hear past broadcasts on our website. Here's some contact information for our speakers today. We thank you all so much for being with us. We again apologize for the technical difficulty, and we ask you once again to complete the survey that you'll get at the end of this broadcast. Thanks all so much for being with us today. Take care.
Okay, thank you.
Bye-bye.